Matthew Heimel.
Good morning, supervisors, and I'm going to turn it over to Dr. Willis, but I did want to just make a few comments. As Dr. Willis will point out, the big issue we're facing with our COVID response is the limited supply of vaccines. And I just want our residents to know that the county stands ready to utilize all the supply we are given, and that we have assigned staff to utilize all the supply and to create the vaccine distribution centers. And I just wanted to take this opportunity to thank all the county employees who are acting as disaster service workers to step up and meet that demand. So, but I just want to, again, let the public know that we stand ready to utilize the supply. We understand the importance of getting it out. And I think Dr. Willis will go into more detail in his report.
Thank you, Matthew. Good morning, supervisors. Good morning, community. Matt Willis, Public Health Officer. I'm going to give it a brief update on our status as a county with regards to our COVID-19 response, speak briefly about schools, and then get into the most important topic, which is our vaccine distribution plan. Next slide, please. So this is where we are. This is our dashboard that's publicly available at coronavirus.marinhhs.org. This shows the total number of cases, the total number of tests, and other scrolling through this site for anyone who's interested, other demographic information. Now we've added information regarding our vaccine strategy to this dashboard. This shows we've seen just over 10,000 cases now in our community with 315,000 plus tests that have been performed. Next, please. This is our epi curve. When we talk about flattening the curve, this is the number of new cases per day on the columns. These are the waves that we have been riding together. On the first far left there, you see that first wave that started in March when we first launched initiated really the nation's first shelter in place with other Bay Area counties, followed by the June and August surge, primarily characterized by about 80% of our cases among our essential workers, Latinx community, and then the surge that started around Halloween, fueled by Thanksgiving, Christmas, New Year's. That surge peaked on around January 10th, and we've seen a dramatic reduction in cases since then. One of the largest just rates of change we've experienced at any point in the pandemic has been the decline that we've experienced from January 10th to about January 25th. We have stalled in that progress a little bit. Just there's been a plateau at about 20 cases per 100,000 residents per day for the past week or so. We're hopeful that our progress will continue and will help us reach out of the purple tier into the red tier. Next, please. I'll speak more about the tiers shortly. This shows our hospitalization rates. Obviously, this has been was a primary concern as we saw ever increasing numbers of cases through December and into January, which led to the governor issuing the stay-at-home order, which was tied to ICU capacity. When we project ICU capacity for the Bay Area region now, based on decreasing case rates, we see an ICU capacity projected of about 30%. So things are looking good in terms of our collective hospitalization capacity over the region. And these are the numbers for Marin. Next, please. This is the purple tier. As we know, the state has removed. There's no more any region is no longer in the stay-at-home status. We are almost the entire state is now in the purple tier with some rare exceptions. We are among the counties that are probably first among the larger counties that may be headed towards the red tier. But this shows is that our case rates on the left there, 28 per 100,000 residents per day over the week period. That's now down to about 20 cases. Just to remind us, the margin between the purple tier and the red tier, when we would be able to relax some of the restrictions, is 7 cases, an adjusted case rate of 7 cases per 100,000 residents per day. Right now, we're at about 15. So we're about twice where we need to be per 100,000 residents in order to move into the red tier. But it's something that could happen as early as mid-February if our numbers continue to improve. Next, please. These are the trends just comparatively from Marin and other Bay Area counties. And it shows that we have been largely following the same patterns as our neighboring counties, but just at a lower rate, at a lower burden, both in terms of on the left, our case rates, and on the right in terms of our hospitalizations. Next slide, please. This shows Marin County's case rates. So this is essentially the most simplest estimation of our burden of COVID-19 as a community. It's the number of cases per day. And it shows that we are right now the lowest among all counties in the state with that are medium or large counties. This excludes those smaller counties less than 100,000 residents because the numbers there are much more volatile and harder to track. But among medium and large sized counties across the state, Marin County has the lowest incidence of COVID-19. We don't want to be falsely reassured by this. We need to remember that this is comparative, and the state as a whole has been experiencing extremely high case rates. The state has been one of the highest impacted states in the nation, and the United States is one of the most impacted nations in the world. So, we are being graded on a curve here and don't want to be falsely reassured by this, but it is a sign of the success of this community and the hard work that everyone has done and the sacrifices people have made to reduce transmission in our community. Next, please. Just want to briefly touch on schools. This has been one of the highest priorities for us in terms of our COVID-19 response and our relationship between public health and the school community with Marin County Office of Education. We were one of the first communities to close schools in that surge in March. There was so much we did not know about the virus. I was concerned that schools might represent risk, especially since there hadn't been a chance at that point for them to develop all the policies, procedures to control spread. Remember, even back then, we weren't talking about using masks routinely. So we were one of the first to close, but we immediately began just the next day thinking about how we would reopen safely. And we were also among the first counties to begin to reopen schools. And it has been one of the most successful elements of our response. We have now 87% of our schools are open to some form of classroom-based learning. We've only had 9 cases of suspected transmission within schools. There have been no occasions of documented transmission from a student to an adult in that community. There have been adult to adult and student to student transmission, but not vertically from students to adults. Next slide, please. And that is despite the fact that we're coming up on nearly 1 million student days. So a student day, and one student day is a day where a child is in a classroom. When you add those up, since September 8th, when we began to reopen schools, we're now up to almost a million. And we think about over 10,000 cases in the community of COVID-19, we are demonstrating that schools are actually, at least in Marin, and how well the schools have organized themselves and how safe that environment is, may actually be protective. It's not, we had been concerned that there might be increased risk, and considering whether that increased risk is justified based on the social benefit, the learning benefit, the mental health benefit of being in schools. We're in fact learning that there is transmission benefit also of schools, and that we are seeing reduced transmission based on the structure and the environment that schools provide children and what it does for the social fabric to be able to maintain that structure for the adults in those communities as well. So our schools are protective against COVID-19. The risk of transmission within schools seems to be lower than it is in the community as a whole on a per day basis. And the alternative, obviously, to children being in school is that they are at home or not at home and mixing in other ways. So again, thank you to our school community, our teachers, our educators, Marin County Office of Education for the courage to work together to reopen schools. Next, please. This is now to vaccinations. This shows our dashboard. This is available to anyone to visualize with us as we grow. It shows the number of new people who have been vaccinated each day. We are now up to 34,000, more than 34,000 residents have been vaccinated, about 11% of our population. So, more than 1 in 10 Marin County residents has been vaccinated. It's not happening as quickly as we would want, but it's important to recognize that that's a significant fraction of our population. If we think about who that is that has been vaccinated, who are those 11%? It is primarily our healthcare workers. We have vaccinated in that phase 1A Virtually all healthcare workers who seek to be vaccinated have been offered the chance to be vaccinated, and the majority have chosen to be vaccinated. About 23,000 of our healthcare workers have been vaccinated, Marin. That categorically protects that sector that is so vital to the rest of our response. Then from there, we've been moving into now our age 75 and older residents. Next slide, please. And this is the number of residents that have been vaccinated on a daily basis. And it shows that solid line just shows as each day progresses. On average, we are vaccinating more people. What is under threat right now is our continued progress because of surprise limitations to us, surprise limitations in the supply that we are receiving from the federal level to the state level and the state to the local level. And I'll talk more about that shortly. Next, please. So this shows those that have been vaccinated in Marin by age and reflects our priority for our most vulnerable residents, those above age 75 currently. We have vaccinated over 1 in 3 of our residents age 75 or greater in Marin County have been vaccinated. We're continuing to work to complete vaccinating our 75 years and older residents before moving into other groups. Next would be 65 and older, along with individuals who are at high-risk occupations as outlined in the state framework. Next, please. And this shows the locations in which, or the organizations that have been vaccinating Marin County residents thus far. Among the 32,000+ doses that have been administered, 8% have been through the CVS Walgreens partnership. We've talked about this. This was the partnership, the federal program to vaccinate residents of long-term care facilities. These are not vaccines that are being obtained in CVS and Walgreens facilities. They're teams that are leaving those pharmacies and going out to facilities on a regular basis to vaccinate residents. And then another 21% between Marin Health Medical Center, Kaiser Permanente, and Sutter have vaccinated about 21% of all the vaccines that have been offered. Marin County Public Health has done 43%, so the largest fraction has been our team in Marin County Public Health. The majority of those vaccinations have happened at our point of dispensing, the mass vaccination site that we've established at the Marin Center that I shared with you last week. And then about 28% of our residents that have been vaccinated outside of the county. That's primarily healthcare workers who are vaccinated in their place of work. We vaccinate healthcare workers in Marin who live outside of other counties if they work in a Marin County facility. And similarly, our healthcare workers, our doctors and nurses who live in Marin but may work in the city, for example, would be vaccinated by their employer in the city. And that's that 28% or so. Next, please. So the problem of supply, this is by far the dominant challenge for us right now in our vaccine distribution plan. As Matthew Heimel indicated, we are at the ready. We have far more operational infrastructure and workers and capacity to vaccinate than we actually have doses available. And the problem of supply really starts with the manufacturing rate. We have, there's only two, there's Pfizer and Moderna. Those are the two products that have been confirmed by this FDA for use in the United States. And they're manufacturing those vaccines as quickly as possible. It's obtained from the federal level. The federal government allocates to states according to a proportional formula, and then the state of California will allocate to counties. The local allocation is determined by the state according to an allocation formula that they apply. We have no ability to purchase or independently procure vaccine. The state is not able to do that, nor are the local jurisdictions able to do that, nor are our hospitals or healthcare partners. We are all dependent on allocations that come to us through the state. We consistently request extra doses week after week because we are moving through so quickly the doses that we receive. And we are not able to, through those requests, obtain additional doses because essentially every county is also requesting extra doses. There are some counties that early in this process didn't have the infrastructure to be able to use all the doses that they were receiving. Once earlier on, we were able to get a few extra doses because some other counties that weren't moving as quickly had those doses reallocated. That's no longer occurring. And then I'd like to speak briefly about the problem of second doses. Next slide, please. So as we know, Pfizer and Moderna vaccine require 2 doses. The Pfizer is about 3 weeks, Moderna's 1 month. So the Pfizer product, it's about 4 days before and after that 21 days where you can receive the second dose. And Moderna, it's 4 days before and after that 28 days. So those are the ranges. Obviously, it stands to reason, but I'll just go through it because it really is an important determinant now of what we're able to accomplish in terms of vaccinating new community members, is that weekly supplies need to continuously increase to vaccinate new residents because of the need for a second dose. For example, imagine you have 1,000 people who are vaccinated with the Moderna product on week 1. In week 4, if we only receive 1,000 doses, no new residents will be vaccinated, because all those doses will be reserved for those that had been vaccinated 4 weeks earlier with the Moderna product. So we therefore rely upon an increasing number of doses in order just to keep pace with vaccinating new residents. This coming week, only approximately 3,000 first doses will be available countywide between Kaiser, Marin Health, Sutter, and Marin County Public Health countywide for next week. And that's because we are all working through those members that have been vaccinated 3 and 4 weeks ago for their second doses and only have a very limited amount of first doses. So what that will do is reduce the rate and the pace at which we're able to access and vaccinate new residents, especially, we're focusing on our age 75 and older. Next, please. Why focus on age? I think, what we just described in terms of the extreme limitations and rationing we need to do based on supply, it makes a lot of sense that the organizer would be around saving lives, that preventing mortality is the single most important goal. And that becomes very clear that we then should be focusing on our oldest residents. In Marin County, 1 in 7 individuals above age 75 who have been infected with COVID-19 have died from the infection. And that's compared to anyone below age 65, well less than 1% mortality rate. A vaccine given to someone age 75 or older in Marin County, based on our numbers, is 332 times more likely to prevent a death than a vaccine given to someone less than age 50. Next, please. And then additionally, because equity has been one of the most important organizers of our strategy, we want to remember that vaccinating older residents benefits all communities. Every community is obviously most concerned about the problem of death and mortality among their oldest residents. And when we look at on the left there, the demographic breakdown by race of those that have died from COVID-19 in Marin County, it matches exactly the proportion of our population as a whole. So every community benefits from vaccinating in terms of preventing death from focusing on our older residents. Next, please. Just to remind, this is material that I covered last week as well, and we'll continue to offer just to remind our community how people will know when it's their turn. Go onto our website, coronavirus.marinhhs.org. We have now over 40,000 individuals who have responded to this vaccine interest form. Once that form is filled out, we have information about your age, your contact information, your name, certain other information, medical condition, whether or not there may be special needs in terms of transportation or other access and functional needs. And then when your turn comes up, as we're able to move beyond age 75, move into age 65 and other occupations, we'll be able to proactively send out a communication to say, your group is up. And at that time, we'll be able to offer the menu of what locations where vaccines would be offered, because obviously as time passes, there will be more and more options for becoming vaccinated, especially as supplies increase. Next slide, please. And then similarly, how do I get an appointment? What this will show, again, as time passes and there are more and supplies allow for more locations to be vaccinated, this will be an ongoing and updated list of options where people can be vaccinated. Kaiser members, Sutter members, Marin Health Medical Center members, Federally Qualified Health Center, our community clinics, as well as corporate options, pharmacies, CVS, Walgreens, Safeway, Rite Aid. All of these are organizations that will be coming online over time to be able to offer vaccines, and this list will be updated regularly. Next, please. So in summary, our case rates are declining. Our third surge is resolving. The stay-at-home order was lifted and we are in the purple tier. We may enter, if progress continues, could start considering that we may be in the red tier as early as mid-February, but it is up to us. Schools are successfully reopening. Our vaccine supply is extremely limited. Our focus is on healthcare and age 75 and older. All eventually will be offered vaccine. What we're asking for is to reset our expectations and to match, match our expectations to the supply we receive. The good news is that we do have a vaccine that is very effective, and all will be offered that vaccine over the next few months. It's really just a matter of how quickly we're able to move, entirely dependent on the supply we receive. And then our goal collectively, obviously, is to prevent our fourth surge. We want to continue to cover your face, physical distancing, no indoor social gatherings. The vaccine is not moving nearly quickly enough into Marin to be the solution to surges and cases. That has to be our behavior. And we want to make that really clear that all the things we've done to successfully control surges in the past, we need to be even more vigilant around moving forward. Next, please. And here's just a reminder of the hope and the promise that the vaccine offers us as we're moving forward. And I would add to that the hope and the promise of knowing that our own behaviors are able to bend the curve, and we're going to need to continue to rely upon that. This is the Kerner campus. This is in the beautiful facility here, the Marin Health and Wellness Campus in the Canal area where my office is, where it's close walk for most residents of the Canal area that have been so hard hit by this pandemic to be able to be vaccinated when we have doses available here. There's a wonderful point of dispensing, a mass vaccination site that's been established here at the Kerner campus, and this was the rainbow that appeared over as Department of Public Health was setting up that mass vac site. Thank you. That concludes my presentation.
Thank you, Matt. Dr. Willis. Can you tell me where a senior where they would call, or how would they sign up if they didn't have internet or computer access?
Yeah, we're establishing a call center. It should be done by tomorrow, where there'll be a number for seniors to call to be able to get. They'll have a bank of people who can field those calls, register individuals telephonically, and we have appointments set aside for them to be able to actually schedule an appointment telephonically.
Thank you. Questions of other board members? Supervisor Connolly.
Thank you. Good morning, everyone. And thank you, as always, Dr. Willis. As you note, really the vaccinations are at the top of everyone's minds. By far, most of the inquiries we're getting, so appreciate the updated information. In particular, as you note, some of the challenges around supply right now. And the message we want to clearly send to our residents is that in Marin County, vaccine doses are not sitting on the shelf or in the freezer. As they are received, they are being put into people's arms. So conveying that message clearly, as well as that we continue to advocate for increased supply and less complexity in the distribution system. So thank you very much for your work on that. Before we get a little bit more into vaccines, circling back to schools, and again, as you note, a top priority here in the county, and very good news that as things stand, approximately 87% of schools are open. We know that our middle schools and high schools are hoping to open in the coming months. Can you give us a time frame to the extent possible of when that is likely to occur?
regarding schools, yes, first of all, it's up to the school. Many of our secondary schools, so middle and high schools, have spent the time over the last few months preparing to reopen. Unfortunately, the surge in November and December and the stay-home order prevented that from occurring based on the state law. As long as we are in the purple tier, secondary schools that have not been opened may not newly open. So those middle school and high schools that are not open would need to wait until we get into the red tier. Once we get into the red tier and we're in that tier for about a week, where we have consistent numbers in the red tier, we can make that policy decision to actually go forward and allow those schools to open. And that would certainly be our practice in Marin. We would be eager to allow our schools to open as soon as the state allows them to. So again, if our numbers continue to improve as they are now, it's possible that we would be in the red tier by mid-February. So that would be reopening middle and high schools that want to reopen. And I know there are several who are ready to go by the end of February.
Okay, so the movement into the red tier facilitates that.
That's right. Yes.
A related issue to that, of course, school transportation. Currently, the number of kids who can be on a bus is limited. Do you anticipate easing restrictions on the number of people who can ride on a school bus, for example?
Yeah, those rules were put in place based on the risk of transmission in that setting, and that doesn't change. The risk of transmission won't change. We're working to optimize the space on the buses, making sure the windows are open, alternating seats, aisle, window. I mean, the configuration is a sound one. It makes sense. We would be reluctant to put more kids into school buses as long as the transmission rates are above a certain level. So we're working with Marin County Office of Education and the school districts to try and find ways to make sure that every child can get to school. This is a great chance to support the safe routes to schools, non-motorized transportation to schools. That's a win-win. So if we can get kids biking to school, that's even better.
Great point. Turning to vaccines, we're focused, as you mentioned, on 75 and above right now to maximize supply and impact. And you may have covered this, but do we have a sense of the percentage of people over 75 who have received their first doses to date?
Yeah, we have about 24,000 residents above age 75. We vaccinated about 8,000. So we're about a third of the way through that group. So we got 2/3 to go. And again, if you do the math, if we have 3,000 first doses available next week, that only gets us partway. We're really into March before we're even through our age 75 plus if we don't get more supply.
Great, thanks. And then equity has been front and center in the distribution process. If you can elaborate on that a little bit more, where do things stand on using equity as part of the process? And what can you tell us about the numbers and metrics to ensure equity?
Yeah, and equity obviously has been an important organizer of our response across the board. Some of the equity protections are built into the tier strategy. Once we move above, beyond age 75 plus, and we start adding occupation, those occupations are really selected. Those occupations that are being favored for earlier access to the vaccine are selected based on the fact that they have been disproportionately impacted. So it's food service workers, it's agricultural workers, childcare workers, educators. So there's a really strong opportunity there to have an equity focus on that. And it's one of the reasons that we've located one of our primary vaccine distribution points here in the Canal area. So there's an equity pod, if you will, an equity point of dispensing. It's already established for us for that infrastructure. We're going to make sure that the appointments in that place are actually reserved for individuals in those communities. When we found that when we just open it up to the population as a whole, and if it's something that is people have to register over the computer, that not everyone might have equitable access. So working on to make sure that there's phone outreach, there's community-based organizations that have access to lists where they're able to actually register people from within those groups. Importantly, there's an advisory board. The community advisory board has been established to make sure that at every step, as we move through the different tiers and different sectors are coming online, that we're able to ensure that there's access for those that we seek to reach in that tier. For example, as we move into our agricultural workers or our food service workers, we know that by definition, many of those individuals are marginalized and are not as connected. And so it's going to take more to make sure that they're actually able to equally access vaccines. And the Community Advisory Board has been organized to try and ensure that we're having our strategies actually match the needs of those communities.
Great, thanks. Yeah, I was going to ask you about that, so thanks for mentioning it. We have seen small outbreaks in assisted living facilities, and if you could kind of summarize when and how can some of our most vulnerable residents in those settings have access to the vaccine? It sounds like we're making some progress in that regard.
Yeah, briefly, the ways that individuals who are living in long-term care facilities are being vaccinated now is two. One is the CVS Walgreens partnership from the federal government. They have moved through 60 plus facilities and are continuing through February to be offering vaccines there. And then our Marin County Public Health team also has mobile teams that are going out to vaccinate in those facilities. Just our numbers, we don't have access to unfortunately don't have access to the data around the CVS Walgreens, the total number of individuals they have vaccinated. We have asked for that data. We hope it's forthcoming. But I can tell you from our side, we've done 2,100 vaccines just from Marin County Public Health in long-term care facilities with our mobile team. So we're that 2/3 or 1/3 of our residents above age 75 that have been vaccinated. A significant fraction of those are people who are living in long-term care facilities through that outreach. And the rate of outbreaks has actually declined. And we think that's attributable to the fact that so many staff and residents have been vaccinated.
Great. And then finally, in addition to vaccines, the other big issue capturing a lot of media attention these days is variants, which we're now hearing more about. What do people need to know about variants that you can tell us?
Yeah, the variants are, a real concern. And there's no easy solution to the problem of mutations that occur naturally, especially when you have so many millions of individuals across the globe who have been infected. We would expect variants like this to arise. Most of the variants we know of now are conferring increased infectivity. So they're more infectious strains. They don't seem to be more deadly strains. And that's the real concern, is that there would be a variant that might emerge that has both increased infectivity and increased virulence. So fortunately, we're not seeing that. But obviously, any strain that's more infectious, the strain that's now circulating in Southern California, they call it the Southern California strain. There's the UK strain, seem to be more infectious. Ultimately, the answer there is all the protective measures we've already been using need to be doubly used, right? So we need to just double down on the best practices, knowing that there are variants that are emerging around the nation and in the state of California. We haven't seen as much in the Bay Area, really, but it's only a matter of time. It doesn't materially change our strategies. It just means that they're even more important than they ever were. With regards to the vaccine, it may be that there's some evidence that the South Africa strain may not, the vaccines that we currently have may not be as effective against that particular strain. The good news is that this particular technology for the vaccines is easily modified to match mutations in the strains, and there may be a booster shot that would be available to cover new strains if it comes to that.
Great, thanks.
Supervisor Rice, any questions? Supervisor Arnold. Got to unmute, Judy.
One question, Doctor. Where is the pinch point in getting this vaccine? Is it Moderna that is slow getting it out? Is it the federal government has rules and regulations before they, they can release it? I mean, I guess if we wanted to say, let's call Moderna, let's call Pfizer and or send one of our emissaries to, what could we do to help break this up a little?
Yeah, I wish I knew the answer to that question. I think that's the question everyone is asking. There seems to be, there seems to be a suggestion that there may be doses that are not moving. I can tell you 100% for sure that's not our issue. We are not even storing. I mean, we have freezers, ultra cold freezers that we don't even use, because as soon as the vaccine comes, we have a point of dispensing site at the Civic Center that can do 1,500 doses a day. We can do 1,500 doses a day easy from what we have. We do about 800 a day because we just don't have the doses. If we get more doses, we'll just add more visits to that machinery. So we're cranking through as quickly as we get them. So the problem's not here, right? So it's either the state or the federal. We're being assured that the state is moving doses just as quickly as they can. So then it bumps up to the federal level. We don't have the transparency on the process itself to understand to diagnose the problem. That's one thing the Biden administration has promised us, is at least clarity in terms of the process itself. That will benefit us tremendously at the local level, because we need, from a planning standpoint, to know how many doses we can expect a week from now, 2 weeks from now, 3 weeks from now. We don't have that. We find out on Wednesday the number of doses we're going to get the following Monday, which makes it really difficult, especially with the first dose, second dose challenges, to actually schedule out visits and tell our community what they can expect. So everyone's asking this question. I think the advocacy for on our side, and we've already done this, you as a board wrote a letter to the governor asking for more doses, recognizing that Marin County has demographically one of the oldest populations in the state. We should be seeing a fraction that corresponds to that. That kind of advocacy is critical, but I think I don't know that there's a magic source of doses that hasn't been discovered. I really think right now the advocacy needs to be around, at least the easier advocacy would be around transparency in the process itself, so that we can plan.
Very helpful. Thank you.
Supervisor Moulton Peters.
Yeah, thank you. I want to follow up on a point that Supervisor Connolly made, Dr. Willis, and that has to do with these variants of the virus and the booster shots that you talked about, and ask whether, because of those variants, it will be prudent for us to continue to wear masks and take the precautions we're taking even after we've received the vaccine. And also, if you could just comment on what is the most important thing for our residents to do right now while we wait for the vaccine in general.
Yes, so after the vaccine, you need to continue to do what you have been doing before the vaccine. And we know that our success as a county has depended entirely on the fact that, by and large, our residents have followed the best practices. We have been covering our faces. We have been socially distancing. We have been avoiding indoor social gatherings. Yes, there are exceptions to that, but any success we've had has been because people have followed those practices. So those are essential to continue. At Marin Health, they have little masks that say, "I got my shot," right? To show that, yes, even after you have your shot, you're going to continue to cover your face. One of the reasons for that is that the studies show that the vaccine protects against infection, it protects against severe outcomes, right? Serious illness. We don't know that the vaccine actually prevents you from becoming infected and infecting others. We can tell you that it really prevents you from getting super sick, which is vital, but you still may be infectious to others even after you get the vaccine. So you need to continue to practice, those practice after the vaccine. And then the most important point is, the vaccine is coming very slowly. We're talking about a few hundred a day at the most. We have 260,000 residents. We're going to need to do 500,000 doses. It's going to take us a long time to get through this. So the things that people have been doing over the past 8 months, 10 months are really the essence and the fundamentals of what we need to continue to do each and every day.
Thank you. Words to the wise. Thank you.
Thank you, Dr. Willis. I'm going to go to the public now, Al, please.
President Rodoni, we have one speaker, caller with number ending in 356. Please unmute.
Good morning, Supervisor. My name's Kevin Carroll with Sausalito Taxi. I just shots, and these are people who normally their only interaction with the county is writing a check twice a year for their property taxes, and all four came out absolutely delighted with the way they were treated by the staff operating. Their fears were handled with, they were treated very kindly, and all just had raves about the operation up there. The two other questions I have, though, is for them, it was not an issue, but it was like $60 round trip for the cab fare. And I've had other customers who were asking me if there's any plans for opening a clinic in Southern Marin and Marin City or in Sausalito. I know the San Anselmo CVS is supposedly going to open up in a couple of weeks, but I haven't heard anything about down here. Thank you.
Yes, one of our key organizers for our strategy is just making sure there's broad geographic access and distribution throughout the county. Southern Marin, Northern Marin, Western Marin. Again, right now with the limitations on doses, we don't have enough doses to diversify in that way yet. We are looking at a point of dispensing in Southern Marin. We're also looking at another drive-through option. This has emerged, we are one of the first counties to do the drive-through testing, and drive-through vaccinations has emerged to be a really good practice for getting lots of, large numbers of people vaccinated. And we're looking at sites for large parking areas for a drive-through vaccination site is potentially starting as early as mid-February that would increase access. And then as we diversify, through our corporate partners with the pharmacies, et cetera, there will be more options available to our residents wherever they are. So our hope is that, that will increase the proximity, how far anyone has to travel to get vaccinated. At the same time, for those that need support getting from their home to those sites, working with Whistle Stop or Vivalon now and other partners, Marin Villages and other partners to organize rides for individuals who, at the end of the day, having helped them get registered for the doses, but either someone having to come to their house, or EMTs or paramedics come out to the house, or have someone pick them up and give them a ride to the site.